In total, there have been 3,346 COVID-related deaths since last March. Healthcare systems across the state are still under crisis standards of care because of all those numbers I just talked about. To help ease that burden, St. Luke's is now offering more services virtually. Brenda Rodriguez joins us now. And Brenda, what does this mean for patients?
Yeah, so virtual services aren't new to St. Luke's, but now the healthcare system added urgent care services, remote patient management, and virtual services for patients in the hospital. Since crisis standards of care kicked in, St. Luke's and other facilities have been flooded with patients. They think these services will help cut back on that traffic. In the midst of the COVID-19 pandemic, telemedicine is allowing St. Luke's to connect with their patients from a safe distance. Just this year alone, St. Luke's has conducted 300,000 telehealth visits. The three new virtual services include urgent care, remote patient management, and virtual services for patients in the hospital.
With this most recent surge, in addition, our emergency rooms and urgent cares were overwhelmed, so we did quickly deploy telehealth on demand, which is an enhancement to what we were doing previously.
The virtual services do not require patients to schedule an appointment and is available 7 days a week. People with sinus issues, sore throats, or rashes can use this service. After COVID and chronic disease patients are released from the hospital, patients can use the new remote patient management tool, also known as RPM, in the recovery process. RPM patients are provided with a kit that includes a blood pressure cuff, scale, and a tablet to easily communicate with providers. St. Luke's also provides virtual care inside hospitals to help support bedside care teams. Providers use pods to ensure patients have a private and secure virtual experience, and St. Luke's is also looking for ways to better assist healthcare providers.
As a virtual nurse, you're not walking out of that room together, but you're hitting a button that says disconnect, and you find yourself alone in a chair and navigating all of those emotions. So we've had to put a lot of attention on how we support our virtual staff.
St. Alphonsus says that they have offered telehealth services for many years and saw an increase of patients at the start of the pandemic. Primary Health has offered this service for a year now, but has recently slowed down.
You know, this last Delta spike, which has been a huge spike and a huge amount of patients coming into our clinics, we haven't really seen an increase in utilization of telehealth, which is surprising, right? You think there'd be a lot more people who would feel uncomfortable coming in, but there hasn't been.
All three facilities say patients prefer in-person visits, which is why they are seeing fewer patients now. They all encourage the community to take advantage of this program. Now, after talking to all three facilities, they can all agree on one thing: virtual visits are here to stay. And they're all working on ways to continue to improve and provide the best virtual experience.
All right, Brenda, thank you.